And we will begin. So thank you all for being with us today. We are planning to discuss Medicare and its supplements, what may be best for you, but understanding the differences and how it can best benefit you. With us to help us work through some of those details is Suzanne Daigle. Suzanne was born and raised in Jennings, Louisiana, which is right around the corner. She has been married to her husband for 41 years. She has 2 children, 4 grandchildren. They moved to the Lafayette, Karen Crow area, which is where her business is, in the mid-80s. She has been working in this industry, in the insurance industry, for over 38 years, writing everything from auto to workman's comp. She started working with Medicare clients around 2005 when the homeowner market got tough due to the hurricanes, the storms, and certainly Katrina and Rita, which were affecting her area as well as others in Louisiana. In 2008, her husband became licensed and joined her. And 2 years ago, her daughter also became licensed and joined them in the business. So it must be interesting conversation around the supper table. Her specialty, thanks to that, which is good to us, is Medicare supplement and prescription drug plans. And so she does say she knows a little bit about Advantage plans. I tend to call them disadvantage plans, but she chooses not to write them because of probably the reason why I call them disadvantage plans. So without further discussion from me, thank you, Suzanne, for being with us, and we will let you have the screen.
Thank you, Kelly. I mentioned to Kelly, I'm not a public speaker, but what I was going to do today is just kind of talk to y'all like you were sitting across the desk from me one-on-one, like I do with all of my clients. So I'm gonna first start with those of you that are here that I can see, maybe a show of hands. I'm sure you already have your red, white, and blue card. You've already gotten it. All right, you've already, Gail, you have your red, white, and blue card. Good. I do have a lot of people. I don't know who else is listening, but some people will come to me and ask, how do I even get started to get the red, white, and blue card? Most of y'all know that you don't usually get it until the first of the month that you turn 65. However, you can get it before 65 if you're considered disabled, and you have to go through this whole application process, which I'm sure y'all know about that. But once you get the Part B, as in boy, turned on, I call it, on your card, then that's when everything starts. You have to have that Part B effective date in order to get a Medicare supplement and in order to get the prescription drug plan. Okay. So if y'all already have the red, white, and blue card, then I guess maybe just going into that, it's more about what is a Medicare supplement. Again, show of hands, do y'all have Medicare supplements right now? Yes. Yes. Gail, you have Medicare supplement right now? Okay.
I have an advantage plan.
You have an advantage plan. Okay. Let me ask you a question. What area are you?
St. Charles Parish.
St. John?
Charles.
I say Charles Parish. Okay. In higher populated areas like New Orleans. I know like Shreveport, Monroe, Baton Rouge. Sometimes the Advantage plan can be a little bit better because they have more doctors on network. I know in my area, in the Lafayette area, and a lot of your rural areas, especially the rural areas, very limited doctor network access. And so that brings me right to the Medicare supplement. The reason why I like to do the Medicare supplement is the first thing I tell my clients is there is no network. Your red, white, and blue card has no network. The only thing with the red, white, and blue card is as long as the doctor accepts Medicare patients, as long as they take a Medicare, what they call beneficiary. So, but there's no network that the red, white, and blue card says you cannot go to this doctor, that doctor, or hospital. The Medicare supplement companies, all of them will give you access to any doctor, any hospital in the continental US. Okay. So again, a lot of my clients, you attain that age or you attain that ability to get your red, white, blue Medicare card. Some people do like to be able to travel, whether it's for family or for doctor visits, specialists, they want to be able to travel. So on your red, white, and blue and a Medicare supplement, there is no network. You can see any doctor, any hospital in the continental US. That's huge. That's huge because again, like I said, if you need to see a specialist, you don't want to be limited. And the only limitation would be if the doctor's office doesn't take a Medicare patient. Okay. With that said, what is the best Medicare supplement plan? There's a new rule that went in. If you turn 65 or you get your Part B on your red, white, blue Medicare card turned on after January 1st, 2020, the only, I say the best, you can no longer get a Plan F MedSup. Plan F used to be the best plan because it had no deductible and it covered everything, hospital and outpatient. But now, since Plan F is not available after January 1st, 2020, Plan G, as in girl, is the best plan that you can get. On that Plan G, you will still have 100% coverage for anything in the hospital. So between your red, white, and blue Medicare card and that MedSup Plan G, you go in the hospital, you'll come out paying nothing. Okay. On the Plan G, outpatient doctors, tests, diagnostic therapy, any of that, there's a small $240 deductible that you have to meet per year. Once you meet that $240 deductible, you have 100% coverage. So it's, now I'm talking MedSup, not Medicare Advantage. Okay. So this is MedSup. I know that's kind of quick and short. When I'm sitting with someone, I'm normally visually showing them this information on paper. I can definitely send that information to Kelly if y'all need that forwarded. But at this point, Kelly, I'm just going to ask if anybody has any questions on just that little bit that I've mentioned. I'm thinking y'all are probably already aware of most of what I just said.
So
if you got your card before 2020, is that still available?
If your Part B date, effective date, is before January 1st, 2020, you can still get a Plan F. Yes.
Okay.
Now,
no, thank you.
now I'll tell you this though, Joe. That is one of the big differences between Medicare Supplement and Medicare Advantage. Okay. If you're already on a MedSup, okay, and you want to look at getting a better rate, a better premium, okay? Let's say you had a plan G, but you want to go to an F. On the Medicare supplement world, they have the right to ask medical questions. So you have to go through the medical underwriting, and therefore that may prevent you from moving from one company to another or one plan to another. However, now I'm speaking about Louisiana specific, so I don't know if everybody on the call is from Louisiana. There are some other states that have this, but for Louisiana, it was August 1st of 21 or 22, time flies, but Louisiana adopted what's called the birthday rule. Now this, pay attention, because this can be very, very advantageous to those of you on a Medicare supplement. Let's just pick a company. Let's just say Cigna, for example. If you have a Cigna Medicare supplement and it's a plan G or F, doesn't matter. And let's just say your rates have gotten crazy, okay, $300-400. That's crazy. You should not be paying that. But if you have a med sup that the rates have gotten high, you can contact your current company, preferably your agent would do that for you, but the agent or the company. So in my example, Cigna, you can contact Cigna, and you can, based on what they call the birthday rule, that's what it's called, the birthday rule. Based on the birthday rule, you can request a new lower premium. Now here's the qualifications. Birthday rule, it has to be around your birthday. My birthday is January 27th, so I'm going to use myself as an example. The birthday rule says you have to ask or apply with your same carrier, and you have to do it the day after your birthday. So I cannot apply and ask for that lower rate from my current carrier any earlier than January 28th. And then you have 60 days. So that would give me the ability to do either a February 1st, March 1st, possibly even at April 1st, depending on when you requested the new lower rate. So the birthday rule says you have to stay with your same carrier. You start the process after your birthday. You only have a 60-day window to do it, but you go back to that current carrier and they guaranteed issue, no medical questions asked. That's huge. Guaranteed issue, no medical questions asked. They have to lower your rate based on the birthday rule. Now, the other qualification it says is if you have a plan, you can request your exact same plan or step down a plan. So when we just talked about a plan F was the best plan they have, a plan G, the only difference between an F and a G is a $240 deductible. Okay, so let's say you've got, just for example, I've got a $400 premium and I'm on a plan F right now with Cigna. Well, if I call Cigna and it's after my birthday, and so I ask based on the birthday rule, I want to see about lowering my premium, I can ask them to give me the same plan F, no change in coverage, same plan F. What would my rate be? And let's say they tell me, well, we can bring it down to $350, but I want to go lower than that. I can ask them for a plan G, and they'll look at the rate for a plan G. This is all guaranteed issue, no medical questions asked, based on the birthday rule. Then you can ask for a G, and they might say, well, we can get you a G, and that'll be $280. Well, I'll take that, because if I can go from $400 to $280, and the only difference I have to come up with is $240 of deductible per year, I'm going to make that up in premium if I get a lower premium on the plan G. And again, birthday rule, guaranteed issue, no medical questions asked for my state of Louisiana. That just started a couple of years ago. Not every state has the birthday rule. You'd have to check with your state to see if they do offer a birthday rule. Again, I'd say, if you have an agent that you're working with, check with your agent or check with the company that you're currently with. Any questions on that?
I'm like Gail. I have an Advantage plan right now. It's a 0 monthly premium plan. can I get a like plan as a supplement?
You cannot go back to a Medicare supplement. But let me also say this.
Wait, I can't go back having an advantage plan. I can't get a supplement now.
I'm going to apologize, but I'm going to assume something here, Joe, that it would be difficult for you to go through the medical underwriting portion of an application.
Gotcha.
So with that said, I have had persons come to me that had a Medicare Advantage and go back to a Medicare supplement, but it depends on the person. And if they don't, the medical underwriting is not hard, but they are looking for chronic condition. So if you had COPD, if you had congestive heart failure, if you have, I mean, then you're not moving. You're not going to move from your Medicare Advantage back to a Med Sup. Now, the important point to understand and learn, though, is when you go to a Medicare Advantage, and I'm pretty certain, I'd say 98% of the time when I talk to somebody, they'll tell me, I didn't know that. Okay, even though you're on a Medicare Advantage plan, when you sign up with an agent or whomever on the phone, whatever, if you sign up for a Medicare Advantage, you basically traded your red, white, and blue Medicare card for a Medicare Advantage plan.
And then that 2%
that's they don't always tell you that. Now, the reason I say that is because when on the side that I do, the red, white, and blue card is still very much used. The supplement, and I normally put my hands together like a gear going together, locking up together. The red, white, and blue Medicare card and a supplement, the two to work together hand in hand to give you a full policy. When you go to Medicare Advantage, you basically, none of your bills go to the red, white, and blue Medicare card. None of your bills from any of your doctors, hospitals, they don't get what they call repriced. They don't go to through the Medicare program. They go directly to whichever company you have on a Medicare Advantage. So your red, white, and blue card really is dormant. Okay, it's just sitting there.
yeah.
Okay.
Use it.
Now, very important. If you wanted to, you can go back to red, white, and blue Medicare card. And you'd have to say, I'm not telling anybody to do this. You have to talk with your agent, your doctors. You have to vet this to whether it's going to be to your advantage or not. But sorry for using the word advantage, but if you'd have to what they call disenroll from the Medicare Advantage to say, I don't want that Medicare Advantage anymore from XYZ company. And if you do that, you can go back to red, white, and blue Medicare card. So you can get full benefits restored back to Medicare and your red, white, and blue card. Now, if you do that, you will not, like we said, based on medical underwriting, you would not have the ability, possibly not have the ability to get a Medicare supplement that will go hand in hand and give you a full policy. Following? Okay.
Right.
So the benefits of the red, white, and blue Medicare card, you can go to any doctor, any hospital, continental US. So if it's a doctor issue, you could possibly, and I'm not advising people to do this, okay, because I don't know your individual situation, but if you said, I want to get rid of the Medicare Advantage and go back to original Medicare, that is the red, white, and blue card. The supplement, the Plan F or the Plan G, is an insurance company, and they have the right to say, we'll take you or not based on those medical questions. Okay. So if you go back to the red, white, and blue card and you get off of a Medicare Advantage, now I don't know how much time we have to explain, but the red, white, and blue card, again, like I said, any doctor, any hospital, continental US, but I'm gonna give you an example. I do this all the time with my clients. Let's say you have just a simple doctor bill and the doctor charged $240. Okay. Well, that $240 now goes to Medicare, red, white, and blue Medicare card. Okay. No advantage and no supplement right now. It goes to Medicare. When Medicare gets that $240, they look at it and say, oh yeah, but we only approved $200 of that $240 doctor bill. Okay. Now y'all all know, and y'all have heard that the red, white, and blue Medicare card says we're going to pay 80% of what we approve. That's your red, white, and blue card. We're going to pay 80% of what Medicare approves. So 80% of $200 is $160. Okay. So the other 20% of that $200, $40 is what you would most likely have to pay to the doctor. Okay. That's where a Medicare supplement normally comes in and picks up that 20%. And so you don't have to pay anything. The $40 that's unapproved, we call that an excess amount. Some doctors and or hospitals, I'm using a small number so we can all think about it, but some doctors and some hospitals will do what they call write off that excess. Some doctors will say, I will accept from you, my patient, I will accept only what Medicare approves. If they say they'll accept what Medicare approves, then they're saying they're going to allow that $40 that's not approved in my $240 example. They're going to say that's written off and nobody has to pay it. Medicare's not going to pay it because they didn't approve it, and they're not going to require you to pay it. And if you had a supplement, they would not require the supplement to pay it. So again, on a $240 bill, $200 is approved by red, white, and blue Medicare, and Medicare is going to pay 80% of whatever they approve. So by not having a Medicare Advantage and going back to original Medicare, you have that coverage, no network, and 80% of what they approve, that's what Medicare pays for. You would be responsible for the 20%. Now, I'm using a small number, but that 20% could be big, okay? And that is why most people buy a supplement to help cover the difference. And the other side of the coin is the Medicare Advantage, which you will still have some out-of-pocket expense, but you pay a zero premium for it. You're limited possibly to your doctors and hospitals. You're limited to their network, and you will still have incur some costs, because on the Medicare Advantage, it's not a zero premium and everything's covered 100%. So.
Right. Now with the supplement, with that, using your example, the $40 covered by the supplement, is that after you reach your yearly deductible, or is that still yours until that point?
Okay, so in my $240 example that we were talking about, on a plan F, it would pick up that $40 where Medicare paid $160 and they would pick up the $40. On a plan G, you would pay that $40. I call it triple.
Until you reach that
until you reach the $240 deductible, then it would be 100%. Then they would cover everything. Right.
Thank you.
You're welcome.
Suzanne, when you say the medical underwriting could affect your ability to obtain a supplement after going back to the red, white, and blue card, you mentioned chronic conditions. ALS is not a chronic condition. I mean, it's not. And I wonder if you have any stories or any examples as to the underwriting to go through for someone that had ALS after the case.
I've when we finish, I can also send something to Kelly that she can distribute to y'all. What I do with my clients, and you know, I've got the ones that are first coming 65, so I try to educate them, and some of the things I've just told y'all, I try to tell them because it's their first time coming in, so they need to know the difference between the Medicare supplement, the Medicare Advantage, and how it all works. So those first people coming in, they're guaranteed issue, no medical questions asked. But I do have a lot of clients, Kelly, that come to me and, you know, in their 70s or 80s. And I've successfully moved. I have my most recent one was an 88-year-old lady, Miss Betty. She's done it several times. But Miss Betty, we moved her from one Medicare supplement to a new Medicare supplement, different company. Okay. And she was able to pass the medical underwriting. I will send it to Kelly. There's, they call them knockout questions. When you apply with a Medicare supplement company, about 85–90% of the questions that are asked from one company is the same through all, you know, 12, 13 different companies. So I can find, I pull a sheet at just the medical questions, and I can send that to Kelly to send out to y'all. But the knockout questions, when you read them, it just says, if you answer yes to any of these questions, it's an automatic decline. Don't even send in the application. Okay. So unfortunately, yes, unfortunately, I do believe ALS is going to be one of those knockout questions. But so I personally don't have anyone that I had with ALS. Oh, but I can give you a good example of one. I have Mr. Mark. Mr. Mark is has Parkinson's. Okay, and he was diagnosed with Parkinson's well before the age of 65. He came to me when his Part B was first started, okay, to learn. So let's just say Mark was, he was probably 50, okay? And when you get a Medicare supplement under the age of 65, the premium is bigger. Okay, I mean, if you're just turning 65 and getting your Medicare card, it's usually about, in my area in Louisiana and Lafayette, it's normally around $110 to $115 a month for a Plan G Medicare supplement. Okay, well, Mark was 50, and when we first did his Medicare supplement, he was paying probably around $300. Okay. He didn't like it, but he was okay with that. Well, he used to tell me all the time, because, and he was guaranteed issue, no medical questions asked when the Part B first starts. So let's say your effective date was July 1st, 2024, and you're 50 years old and you got Parkinson's. But if you come get your Medicare supplement for July 1st of 2024, when it first starts, guaranteed issue, no medical questions asked. That's huge. That's big. Okay. So he came in at the right time. We did that. And so he was paying, say, $300 a month or whatever, and it would continue to climb. Okay. Well, over those 14, 15 years, and he'd say, oh, I'll probably, because he'd have not the birthday rule, but he'd have a second opportunity to lower his premium. So from $300, he could get in to like $100, $110, okay, $110, $115, but when he turned 65. Because just like everybody that gets their Part B starting at 65, if you're under 65 and you get the Part B early, again, pay attention, it's huge, okay? Because if anybody on the call is under 65,
we got that.
Okay, if you're under 65,
we got that situation.
Good. Okay. And you're under 65, and let's say you have a Medicare Advantage, because that's all you can get right now.
We don't have that.
Right? Okay, but under 65, meds up, the premium is a little bit higher. When you turn 65, be talking to your insurance agent or calling your insurance company. Hopefully you have agents because that's easier. But you want to call your agent or your company just before you turn 65 because you can change plans, Medicare Advantage to Meds Up, one Meds Up company to another Meds Up company, F to a G. You can do all of these things, guaranteed issue, no medical questions asked at age 65. So Mark used to tell me all the time, oh, but Sue, I'm not going to live to 65. I mean, his Parkinson's, he thought I'm not going to live till I'm 65. Well, I have good news. He turned 65 in February of this year. And we got together and he is happily paying $115 for his Medicare supplement plan F because he started before January 1st, 2020. So he's very excited. And his premium was up to, I think, like $650 a month he was paying. And we dropped it down to about $115. So he was ecstatic. So it's not an ALS story, but it is similar. Okay. Now, the other thing, and I told y'all earlier, is you have that when you the best time to get a Medicare supplement is when you first get your Part B started. So on the Medicare Advantage, if you're in that Medicare Advantage and you want to try to get back to a Med Sup, the next opportunity would be if you're not 65 yet, when you turn 65, you can go back to original Medicare and get a supplement, guaranteed issue, no medical questions asked. I think that's probably the most important thing. If anybody's not 65 yet, that's huge. Okay.
And a lot of people aren't when they're diagnosed.
That's why I'm saying that. That's really, really huge. It's the first time you get Part B may have been because of a disability or an illness or something. Okay. So the second time that you, and within the first time when you get the Part B, you're guaranteed issue, no medical questions asked. But if you went the route of a Medicare Advantage and said, oops, wait a minute, I realized that's not what I want, you may have a second opportunity to go back to a Medicare supplement, guaranteed issue, no medical questions asked. Other than that, like I was talking with Mr. Joe, you would not, when you see the medical questions, you would not be able to pass the medical underwriting after 65 and move. Okay. One other thing I want to mention, another quick story. Some very good friends of ours, her mother was 80 years old. She's still with us. She has absolutely no medical issues, no medical conditions. She was not my client. Okay. 80 years old. She walks out to her mailbox and she got hit by a car, flipped her, broke her pelvic bone and, pelvic area. The good friend called and told me what happened to her mother, and she didn't know anything about her mom and dad's coverage. And she called and she said, Sue, they got a Medicare Advantage plan. And I was like, what can you do? What can can you help her? Well, now mom's laying in the hospital. She can't answer the medical questions. She can't, pass those medical questions. I'm like, there's not a whole lot you can do. Well, what we found out is she could disenroll from the Medicare Advantage and go back to original red, white, and blue Medicare card. Now she couldn't get a supplement, right? Because she can't pass the medical underwriting. This is why, and this was, it was crazy. We were all calling and asking a lot of questions. Mom is laid up in the hospital. Now, of course, the auto accident person, I'm sure they're paying for, whatever. But in the meantime, mom's in the hospital. She's now getting to the point where she's recovered, had surgery, recovered, and they want to move her to a rehab place, right? The rehab place, all of them, but the one that they were speaking to said, sure, we have a bed, we can take mom. You need to upfront us $18,000 in order for mom to cross the threshold and come in. And they're like, why? Why do we have to give you $18,000 up front? And they were like, because she had a Medicare Advantage. It just, I don't know everything about Medicare Advantage, but it was, when it came to a rehab place, they said, you have to give us the $18,000 up front. So honest to God, they disenrolled in the Medicare Advantage. They went back to the original red, white, and blue Medicare card. And now the rehab facility said, welcomed them with, they did not have to pay the $18,000 up front. Now, our example earlier with the $240, there's going to be some 20%, right? But that's after red, white, and blue decides what's approved and they pay 80% of what they approve, you have the 20% left over. But that was still easier for them to swallow than to come up with $18,000 right out of pocket. And I'd never really experienced anything like that before. But they went from the Medicare Advantage back to original red, white, and blue Medicare card. She was able to enter into the rehab facility without coming up with a large out-of-pocket expense. And I've talked to my friend, but they've not had any more issues. That was, I think that was, again, I think it was the first part of this year. It was either end of the year or it was first part of this year. And I believe mom's home and out of rehab. And now if mom recover, she gets released from her doctor. They haven't called me back to ask me this, but if she gets released from the doctor and she still has no other knockout question health issues, she can come to a Medicare supplement as long as she can pass those medical underwriting questions. So that's another example of something I've recently had.
I have a question.
Always ask questions. Okay, go ahead, Diane.
Yeah, I have a peculiar situation that we keep running into. David is on Medicare and he is under 65. I retired from the state under 65. So when David was disabled and he got on Medicare, every time that we have had to do the wheelchair in the background, anything that comes up, they're flip-flopping who's primary. And he's been like disapproved so many times. I've had to call and try to ask what's going on with the situation. And Blue Cross, that's who we have with the supplement, has told us that they were the primary because I was under 65. But the doctor's offices insist that Medicare is the primary. So have you run across any situations like that? And what's the best way to convince people to submit insurance claims?
Okay, I'm gonna ask a couple of, I'm not a claims specialist, so I gotta give my disclaimer out there first, okay?
Right.
First couple of questions. When you said you retired, you kept your retirement insurance? Okay,
Yes.
so
yes.
that is technically not supplement. It's supplement insurance, but it's not a Medicare supplement. So if you're under 65, you still have like an individual or a group plan. You still have on your retirement group policy, you probably still have a deductible and then an 80/20 and a max out of pocket and all of this.
Right.
And you have your husband also, you kept him with your group plan. Okay.
Right.
This is the way I help people understand it. The federal red, white, and blue card, Medicare, is a federal government program, right? Okay.
Right.
If there's anybody else that can pick up the bill and foot the bill, Medicare will let them. So your Blue Cross is primary.
Okay.
Medicare is secondary. Now at the doctor's office, the reason they keep thinking that Medicare is primary is because everybody else that does not have a group or an individual plan like what you're describing, they have a red, white, and blue card and a Medicare supplement, plan F or G, which is the insurance company. Okay. In that particular situation, Medicare is primary. and
Mhm.
your supplement is secondary. But because
Okay,
group plan and Medicare is not the primary, they will definitely let anybody else pay.
okay. So
Those-
so I have to, maybe the key would be he is on a group plan and maybe they will understand and submit to Blue Cross first.
That's right.
Because I keep trying to, yeah, because we're dealing with the formula now. He just got a feeding tube and that was denied. The formula was denied. So
So let me ask you, how old is David?
63.
Okay, very, very important. You want to kick him off of your group at 65,
Okay.
and you want to get a Medicare supplement because it'll be guaranteed issue, no medical questions asked. And
And
now
that's supplement F.
no, it'll be on his card. An agent will look at it and
Forms.
tell you whether you can qualify for an F or a G.
Okay.
So if his Part B started before January 1st, 2020,
He
would
just got on it. He just got on Medicare this year. So it'd be a
okay.
G.
Then it'll be a Plan G. The only thing about the Plan G is, I mean, it's the best you can get now because they don't sell the F anymore, but you'll have a small $240 deductible. That's it. But in this situation you were just talking about, the month that he turned 65, his birthday, let's say his birthday was July 9th, July 1st, okay, the first of the month that he turned 65, he can get a Medicare supplement plan, guaranteed issue, no medical questions asked. So you just let the group know, hey, he no longer needs coverage as of June 30th because he's going to be on Medicare. You need to talk to a Medicare supplement agent and
Right.
that
Okay.
help you through that, but it'll be guaranteed issue, no medical questions asked, and you take him off of your group, and now he'll have what everybody else has, a red, white, and blue Medicare card with a supplement, and that's all he needs.
Okay. Thank you. That's very, I'm sorry I was late, but my alarm didn't go off. I don't know what I did, but I said it. I'm sorry. I'm glad Kelly texted. Thank you so much for the explanation.
Elaine just joined us, and I don't know if you have any general questions, Elaine, or
I don't really, but I really just wanted to hear the conversation because I always have questions about Medicare. I am already on it, and so is Jim, and we have, a certain provider that we chose, and I'm not sure if that's the best one. SilverScript is mine, I think. SilverScript.
SilverScript sounds like a prescription drug plan.
Yeah, that was one of the things
we
we had to choose, and I didn't know if that was a good one or not. But I don't seem to have to pay for anything much, but the VA picks up the difference, I think, which makes it helpful, like incredibly helpful. So I don't have a question beyond that, but I wanted to be here for the whole thing. I didn't have Wi-Fi, Kelly might have told you, but I came to this coffee shop. So I'm here anyway. And we'll watch the whole thing again when Jim and Hilda can watch it.
thank you for joining.
Thank you. Yeah, thank you.
So I told you, Sue, that I wasn't going to ask you questions, but things that you have about this, but things that you have said make me wonder. And maybe you can just help me think through this. But I have talked to you about the difference between maintenance PT and occupational therapy for our, and Medicare will pay for maintenance therapy. I have the rule, I have everything that I need. However, I'm wondering if a provider is more willing to submit payment if there's a supplement or an advantage plan. I'm wondering, so like if somebody has an advantage plan, I'm thinking because I how I feel about Advantage plans, they're going to say, no, we can't bill Medicare for maintenance therapy. But if you have a supplement plan, maybe they would, or I don't know. Do you have any thoughts? And if you don't, I understand.
The things that come to mind based on what you just said, is the red, white, and blue Medicare card, Medicare program is, I'm getting ready to say this, but I'm gonna laugh, but it's pretty black and white, okay? You know, no gray areas. Of course, there's always gray areas, but the Medicare program is pretty cut and dry, okay? And everybody that has a red, white, and blue Medicare card, everybody gets the exact same coverage. Now, we talked about this earlier though, and we said, but if you go to Medicare Advantage, you're not really on the red, white, and blue Medicare card anymore. So when you go to a Medicare Advantage, again, there's multiple companies that offer Medicare Advantage. So what I'm going to say to what you're describing is when you pass on the red, white, and blue Medicare card program to go to a Medicare Advantage, every one of those Medicare Advantage plans can be different. They're all different. They can be zero premium. They can maybe be $20, $25 a month premium or whatever, but they all have different networks. They all have different doctors. And so what we said a little bit earlier, I touched on, is now the bill goes directly to XYZ or ABC, Medicare Advantage. Well, how they're going to pay that therapy bill is based on ABC or XYZ company. Where when you're looking at a Medicare supplement, a red, white, and blue Medicare card and a supplement, when I tell you about the Plan F or the Plan G Medicare supplements, they're called standardized plans. Every Plan G is exactly the same coverage from every company, no matter who you get it from. So the red, white, and blue Medicare card, together with that Medicare supplement, it doesn't matter what company, all your bills are going to be priced and repriced and looked at the exact same way from Medicare and the Medicare supplement. But when you pass on the Medicare card and you go to a Medicare Advantage, now it's at the discretion of that particular company and what they're going to pay and how they're going to pay. Does that make sense?
Yes, absolutely it does.
I like to try and make sense out of things.
Absolutely it does. Okay. Well, Elaine, you had a question?
Well, I don't know what y'all said before, and I'm not sure, Suzanne, what your affiliation with this is. I don't want to offend you, but I always had the sense that Medicare Advantage was erratic in paying or in covering certain things, and now this makes sense from your explanation.
Just a 3-minute explanation, right?
It does. It really
Yeah.
helps me.
Yeah.
Okay.
I hope you don't work for Medicare Advantage.
No, that's not.
Well,
Okay, good.
I'd like to offer though, I think what Suzanne said is true. It depends on the area you're at.
That is correct, Ms. Gale.
I have been with this Advantage plan, I know for at least 10 years. And they have never denied me coverage from anything. And
That's awesome.
wheelchair, therapy, everything.
That's
Yeah.
awesome.
The one I'm with was bought out this year by another company.
Oh,
Now,
And that's why I'm here, because the rules are slowly migrating to that company. So I can't depend necessarily on the same coverage, but that's true to a point anyway, because every year that coverage is changed, I guess based on what Medicare is requiring.
I think the point, Ms. Gale, that I'm glad you say that, because some people may not have been on in the beginning, but New Orleans, okay, Oshner's is a huge network, excuse me, down there. And I have heard a lot of people say that the Medicare Advantage down in the New Orleans area is good because there's so many doctors. Let me put it into perspective this way. Let's say there's 2,000 doctors in New Orleans, okay? And 1,000 of them take the Medicare Advantage. Well, you may not be able to go to the doctor or all the doctors or any one of the doctors that you want, but there's 1,000 to pick from, okay? And then of that 1,000, you have to separate it out into specialties, okay? Well, you come to Lafayette, and I mean, we got a lot of doctors, okay? But you may only have 1,000 doctors, okay? Then with the Medicare Advantage, you may only have 300 of them that want to take the Medicare Advantage. And of those 300, again, you have to break that out into specialties. So this particular doctor that everybody says is the best, you got to go to him, is the best, whatever. Well, he's not in your network. Where with the Medicare supplement, the red, white, and blue Medicare card and the supplement, as long as they take Medicare patients, you can go to any doctor you want. And so I agree with you, Ms. Gale. There are some areas where the Medicare Advantage could be advantageous, especially because of the zero premium. But it's been very well documented, very well known in the Lafayette area. The doctors are just not willing to take the whatever the criteria that the Medicare Advantage companies want or expect from the doctors. They're not willing to settle for that whatever that criteria is. And then also in your rural areas, the less doctors you have in a populated area, the less advantageous a Medicare Advantage would be. Does that make sense? I'm saying it out loud, but I think it makes sense.
But I've also seen the opposite. Some of the advanced plans won't accept brand new doctors. So it takes a while for that doctor to get established and get approved by that advanced plan. I've faced that situation. I've also faced a situation. My primary neurologist isn't on my advanced plan, but there's some deal there where they're supervised by an Osner doctor that's on that plan. They can submit to there. So there's, it's not a hard and fast rule.
Right.
And I think that speaks to the bigger plan. Making, that's great. That's good.
Yeah.
Now, do the supplemental plans with my advanced plan. I have a chronic care nurse and a chronic care manager that I can work with if, let's say, when I'm in my formula, I needed some special considerations. Are those people available in those supplemental plans?
Are those types people advantage?
Those support people.
Yeah, the support people in the supplemental plans, Sue, is that something? Like she has a support,
if I understand, go ahead, Kelly.
She has like a support care person. She has a nurse that is a part of her plan that she, can help guide her, help her with planning of her condition.
Right, and that support person comes from the Medicare Advantage company. It's provided by the Medicare Advantage company. That is something that they do. Some companies do better than others. Like I said, I don't do the Medicare Advantage, but I know enough about it, and I have heard about care coordination nurses or care coordination people. And some companies do better than others. Like, they'll say we have a care coordination. Normally they have a nursing background or some kind of a medical background, and they have care coordinated people specifically for diabetes or for heart or for, maybe ALS or Parkinson's or, and that can be an advantage if you have the right area and the right Medicare Advantage plan. So if you were looking to, if you were shopping for a Medicare Advantage plan, I'll say this, just in our little conversation, you need to know, all plans being equal, all plans being zero premium, you still need to know enough. You need to have enough questions. You need to ask enough questions of the Medicare Advantage company to make sure it's going to fit your needs. And so that, if you were going to look into a Medicare Advantage plan, I would definitely make sure not just the agent, but the company itself. And I always ask to see things in writing. I'm sorry, that's just the way I am. So I would definitely ask about how do they handle care coordination between the Medicare Advantage plan, doctors, and patient.
So my question is, are they available in supplemental plans?
Yeah, do they
Or
have,
is that-
right, do they have that type of coordination in supplemental plans with Medicare?
It's not as, actually, to answer your question, I'm not 100% sure. I believe there are things like that. You just probably have to ask for it, because a lot of times on the Medicare supplement side, the member for Medicare and Medicare supplement doesn't normally have as many issues. But I will say this, I have a lot of clients on Medicare supplement that have multiple issues, and I have heard some clients speak about care coordination from the insurance company. So it's not going to come from the red, white, and blue Medicare card. It's going to come from the insurance company. And so if you ask for it, I don't want to say it's a, I don't want to say it's something that's built into every Medicare supplement company, but if you ask for it, I do believe they have something similar to that. But the Medicare Advantage does toot their horn about
Care coordination.
right.
Okay.
I apologize. I don't know that much about the Medicare. I know enough, but I don't dive
Okay.
into the deep details of Medicare Advantage.
And Gail, I can find out the answer to that question.
I'll ask that question. As a matter of fact, I'm gonna write it down. So
Okay, great. And then I'll let you know when Sue finds out, because that's a great question when you're comparing apples to apples.
care coordination, yes.
Yes. And particularly with someone living with ALS, because there is so much going on. I think having that extra insight is important.
Yes, because you all have the ALS in common, but you're not, you're all unique individuals. So one may have ALS with diabetes, one may have ALS with heart issues, one may have ALS with some, and how your care from your doctor and your pharmacy, your prescriptions, how all of that comes together can be different. Yes. And like I said, most care coordinators have a medical background. That's their specialty.
And a lot of times, and I don't care that if this is recorded, but a lot of times a neurologist, when diagnosing someone with ALS, will tell you to choose your poison, because there's just not a whole lot of room to be caring for other chronic conditions, when you, when you have ALS.
Yeah, you have to treat the whole person. You have to treat the whole
Yeah,
body.
I understand, but you also have to be your own advocate. So it's important to know that, like I said, if you have someone that's helping you with your coordination, that can be, the person can be the center of the situation and not the disease. So, well, guys, believe it or not, and Sue was worried that we wouldn't talk in a whole hour. But we have, and we've gone over that, and I would love to stay here. Unfortunately, I have another meeting at 1:15. So, but Sue and
Thank
I
you for
will
doing this.
connect
Thank you.
and get the information. I will share with all of you, and we'll also make it a part of the presentation that'll be put on YouTube. So the answers to the questions, just so the follow-up. But thank you very much. Thank you
Thank
all
you.
for being here. And I hope you all have a great afternoon.
Thank you.
Thank
Y'all
you.
too. Bye.
Bye-bye. Thank you.
Bye.
Thank you.
Take care.